Now we spoke about heavy menstruation bleedings, and talking about the treatments of heavy menstruation bleedings, it was more focused on is bleeding. So you basically give drugs that will reduce bleeding, drugs that will reduce bleeding. Do you understand? We didn't actually list out the surgical methods, but sometimes this bleeding could actually get out of hand. So you might actually want to employ some one or two surgical ways, okay, to be able to tackle the bleeding. So for treating menorrhagia, first of all, menorrhagia is heavy menstrual bleeding. So there are some surgical, ways in which you can actually use in treating it. So one of the surgeries is endometrial ablation. Okay. So menstruation usually comes in because the lining of the endometrium too is kind of thick and slowing off. So this one, you just destroy the lining of the uterus. Okay, that's the endometrium. And that actually helps to reduce the bleeding. Okay, helps to reduce the bleeding. This is endometrial ablation. You are scraping it up, the top part. Okay, techniques: you have the thermal balloon, radiofrequency, cryoablation, microwave or hydrothermal ablation. So it's best for women who do not wish to get pregnant again. Women, if a woman is approaching her menopause, have myomectomy. So if the abnormal uterine bleeding is due to fibroids, you just do a surgery to remove the fibroids. Okay, hysteroscopy for submucosal fibroids, laparoscopic if you are dealing with bigger fibroids, so you have to just open the stomach. The uterine artery ablation. This is when there's too much bleeding in the uterus, so how about I go and I block the blood supply to the uterus? Do you understand? So it's a technical stuff. So it blocks blood flow to the uterus, which will also be supplying fibroids, or which could be the direct bleeding source. So it's performed by interventional radiology. That means as you are putting this embolic stuff to actually block it, you are imaging just to see that everything is accurate all along. Okay. So it's best for women with fibroid-related menorrhagia because you starve the fibroids by blocking the blood supply. Okay. Then we have hysterectomy, where bleeding is from the uterus. So let me just remove the uterus. It permanently solves the issue, right? So that's complete a removal of the uterus. You can remove the uterus and the cervix. You can remove the uterus only. These are the subtypes. Okay. Then it's best for women with severe and abnormal bleeding that has been coming back for years. Okay, so just permanently solve the issue. Okay. So these are the various surgeries that you can actually do to treat abnormal menstrual bleeding.